My name is Dr. Vincent Ogu, and I'm the chair of Africa Health Australia, a community-based organization that works with African communities. I would like to acknowledge the traditional owners of the land. I pay my respects to elders past, present, and emerging. This always was and always will be Aboriginal land. The African Health Australia has in the last 5 years been able to build strong connection with community, with African community leaders, with partners and networks, NGOs that work with us in the process of creating community awareness and ensuring that the relevant information is passed on to the community by people who the community trust. An example is during the COVID, when the COVID broke out, pushing the information, the right information, the right connection, using the right medium to convey the message by people who are trusted by community was very crucial. So African Health Australia was able to rally around our community, engage them in forums and information, hear from them and build on that to ensure that we keep our community safe. Trust is credibility, able to believe what you are saying and able to rely on what you are saying, knowing that whatever information you put across is genuine, is in the interest of the community. We have seen over this period, the emphasis and the focus have changed over the years from a time when we need to let the community know that it is real. It can actually infect Africans, for example, young people can be infected, to a period when now encouraging people to take the vaccinations, and even currently now that we're still dealing with for some of the aftermaths of mental health and well-being. The AHA, Africa Health Australia, AHA, has been very active in trying to ensure that our people are safe, ensure that our people understand what is mental health and what it is not, and to deal with some of the stereotypes, some of the preconceived opinions about what it is, and trying to educate the community with the right kind of information, and that information coming from people they trust. I think part of the challenge, what I may call the framework in which the current paradigm in which the government relates with communities are pretty much more or less not so much recognized, and their leaders are therefore not so much recognized. But the COVID brought to the limelight that the community leaders, so it is important to begin to reinvent the channels, the paradigms that are in place in reaching the community. I know it's not a one-day thing to sort out immediately, but it will be important for both the government and the NGOs to start to rearticulate what actually is the best way to reach the grassroots, and what is the role of community leaders and community-based organizations in this process. So Africa Health Australia, in order to be able to break that challenge, had to start networking with organizations such as the Western Sydney Migrant Resource Center, which helped us a lot in terms of breaking out and reaching out to other organizations such as Settlement Services International, Multicultural New South Wales. But being able to break through that, to come to the limelight, is a challenge for community-based organizations. We are ramping up our campaign, our outreach in terms of mental health and well-being, the community in languages. We've had a forum which was sponsored, and with all gratitude to Western Sydney Morrissey and other sponsor organizations, including the Multicultural New South Wales. We held a forum and heard from the community their perspectives on mental health and well-being and how it is impacting the community, some of the impediments, some of the barriers to accessing services, or even understanding what mental health and well-being is. So we unpacked it in that forum and translated that into clear, concise message to the community in languages as well. But beyond that, we are currently undertaking Africa Health Survey. The essence is to have an understanding of the baseline of the health status of our community, and then to be able into the future and to identify some of the key health issues that could help us in terms of advocacy, and then going forward, be able to gauge whether that baseline, whether we are improving or in fact, whether the health outcome is declining for our community. That is important to us. And we also have in mind to have Africa Health Forum to bring both the state, the NGO, the tiers of government, the community-based organizations to have some specific focus on the best ways to improve health and well-being outcome for our community. There is a saying in Africa that health is wealth. And in order to maximize the contribution of our people, of migrants, from people of African background in this society, it is important that we do not take our health for granted. Fortunately for me, I've been on both sides of the fence in terms of policy making, but at the same time have worked extensively with community, including my role at Western Sydney Mauritius as the chair for many years and leading Igbo Community Australia, being very active in the African community, and now the Africa Health Australia. I think one of my key messages will be to really take community serious, to really listen to community, and not just information sharing, not just peripheral engagement, but to find what I may call a sustainable way, an intuitive way, a more engaging, a more trusting way of engaging with community, co-producing, co-creating solutions for the various issues that the various ways the various service organizations engage with our community. Let it not be tokenistic. Let it be genuine. Let it be real. I really want to engage with them. Let us work with them. And together, let's find some solution. I think that will make a profound impact and have a profound effect in our community, particularly in trusting government, building that trust, building that bridge. Yeah, I think it is important to sometimes go outside the square. I know there are some conventional opinions and views, paradigms on how, typically you engage. But we are talking of diverse communities here. We are talking of people coming from different backgrounds. It is therefore important to actually devote on time in terms of unpacking what works best in engaging with these diverse cultural communities. And one size does not fit all. One size does not fit all. It is therefore important that policymakers do not just lump people from cultural and linguistic background as one basket. There is need to take into consideration some of the cultural and social realities within these communities, and therefore trying to unpack the best way to engage them. Sometimes, for example, working on engaging with African communities. What are the steps? What are the best ways to get some results? I think we need to think about that. And it's also important to have a way of building a bit of an intelligence within the community, so that if you are coming up with new policy formulations, drugs, you find a way of gauging your ideas, your steps, the outcomes you want to generate, have a way of sounding that with community, with key community leaders who will give you their views up front so that you take that into consideration in the process of formulating your key policy outcomes. What I do not particularly fancy in my career is having to eventually evaluate and then realize at the end how I wish we have done it differently, how I wish we have taken this into consideration, how I wish we had engaged with community much more substantial manner. I think we can be able to build that bridge, to overcome that by creating a credible, trusting, genuine engagement and relationship with community. I would really want to acknowledge the community-based organizations that are working in Western Sydney in particular. There are a good number of them, but and in particular, the Western Sydney Muarisi Network, be it the Western Sydney Muarisi, be it the Core Services International, the Main Services International, Multicultural New South Wales that has been there. When you call on them, if you tell them this is an issue, there you go. They try to work with you to find some solutions, particularly during the COVID period. They really, really showed leadership. So I want to acknowledge the community-based organizations that have been working with our communities. They are fantastic, and encourage them to not relent. Together, we'll get there.